Hi, Dr. Harrison here, and today I want to talk about a very important part of my practice, and that is the area of functional medicine. A lot of people don't really know what functional medicine is. I guess the best way to state or explain functional medicine is it's a way of looking at the patient in a holistic manner where it's kind of a patient-centered approach. We're always really taking a very thorough history to find out what is going on with this patient. Most people who fall into the functional medicine category are going to be people who are suffering with autoimmune conditions, hypothyroid, type 2 diabetes, cardiovascular problems, lupus, irritable bowel syndrome, celiac disease, Alzheimer's, Parkinson's, all these different conditions largely driven by the same types of processes in the body that break down and or are being interfered with. So in order to determine what's going on with these patients, because these patients are relatively sick, we have to do a very, very thorough history. So our first visit with these patients usually runs about an hour and 15 minutes of one-on-one time. And we're trying to really look upstream and identify not only what are the totality of the symptoms this patient's experiencing, but what is driving these conditions in their body. What are the sources of irritation, or what metabolic processes have maybe been broken down in the body that are causing them to not self-regulate or heal on their own? Why are they manifesting all of these symptoms, and why did it start when it started? Many times we can identify these things with a good history. And then from there we can make a well-educated approach as to how to restore normal balance to their systems. It's your neuroendocrine system, the nerves in the body, and the endocrine system in the body that kind of coordinate and control homeostasis in the body. So we want to make sure things are all working together. And many of these, as I stated, are autoimmune. Almost all of them have an autoimmune component to them, which means we're working with the digestive system a lot. You're like, why the digestive system? I thought you just said the immune system. Well, it's pretty well known in the medical literature that 80% of your immune system is tied heavily into your digestive tract. So usually we'll find that people with these autoimmune conditions, the ones I mentioned earlier, have gut issues. Maybe they have food intolerances. Maybe they're having constipation, maybe diarrhea. Maybe they have hard time digesting certain types of foods, or they have a lot of food sensitivities or allergies. Well, that makes sense. If you're eating the standard American diet, you're setting yourself up for autoimmune over time. And there are other things that can trigger autoimmune conditions. We usually will find heavy metals can be involved, or just general toxicity, bad standard American diet, eating too much sugar and not enough good saturated fats, but eating the wrong kinds of fats and the wrong types of proteins, are very, very crucial. So we look at all these different things, kind of tie it together, and then we see great responses with our patients. So if you're suffering with hypothyroid, type 2 diabetes, any other type of autoimmune condition, and you want to see if there's something that can be done to help you towards a better way of health and take you to a new level, you found the right place. Go ahead and call the office. See if you're a good candidate for a consultation. I don't accept all patients because, number one, this work is time consuming, and so I can only work with patients who are fully committed, because I'm fully committed to giving you the best of what I have and trying to coach you to a healthier situation. But I can't force you to do all the things that I need you to do, and they aren't always easy. So if you're committed, definitely there's something we can do to work together. If you're not committed, maybe watch some more videos that I have online. Educate yourself a little bit more, and until you're ready to be fully committed, then we'll be a better match for one another. Second reason I don't work with everybody is I'm not an expert in everything. So I'm really an expert in autoimmune and inflammatory processes in the body and how to calm those things down and help the body achieve homeostasis again. So if I find that you're outside of my realm of specialty, then I'll try to refer you out to somebody who's better suited for your situation. And that does happen on occasion. And then lastly, like I said, This work can be time consuming, so I have to limit the number of people I work with. The most I can take in a month's time are probably 8 patients or so to make sure that I keep the quality of care up. That way I can spend more time with you, give you more one-on-one attention, and make sure that it's a win-win for both of us. I hope you found this information useful. If you have any questions, log on to our website, orlandochiropracticrehab.com, or call the office and we'll set up that phone consultation. I look forward to helping you here in the office.